I'm so very excited. I'm so very excited to be with you all this afternoon. First of all, some housekeeping rules. To participate, please rename yourself and share your details into the format that I'm going to put into the main chat box. So the name, your name, the organization, and then the country. And feel free to introduce yourself into the chat box. The webinar today will be 180 minutes and will be conducted in English. And the session will be recorded for documentation and cross-learning purposes. And this will be available for future viewings through the AppCom Facebook page and YouTube. Please keep your microphone on mute at all times unless you are speaking. And there will be allocated time for Q&A in case you want to ask some questions. Please raise your hands before you speak. For other questions, you can please utilize the chat function. And speakers are encouraged to be proactive in responding to the questions in writing in the chat box. And the chat box, of course, can be used for networking purposes. The idea is to connect with each other and to collaborate. And also a reminder to be respectful to all speakers and participants in every aspect. The webinar is a safe space where people of diverse backgrounds can come together to learn, to appreciate, accept, as well as celebrate differences and find solutions for our continued discussions. So this capacity strengthening webinar for today is led by AppCom, but with the support from all key population regional networks, APN+, APNSW, APTN, ICWAP, NAPUT, and Youth Lead. And on behalf of AppCom, I thank you all the regional networks for your support for this webinar. Also, this webinar would not have been possible without the funding support from the US Centers for Disease Control and Prevention, US CDC, through UNAIDS RST Asia Pacific. So I would like to thank the US CDC and UNAIDS RST Asia Pacific for your support as well. And last but not least, thank you for all the speakers from the Global Fund, ITPC, regional network members, UNAIDS, and community partners for taking part and being available to speak in the sessions. We are also doing this similar session tomorrow that will be led by ICWAP for cross-learnings at the same time. So please also do join in for tomorrow's session as well. So why are we having this community-led monitoring webinar? As you may know, the Global AIDS Strategy 2021 to 2026 on ending inequalities identifies the importance that the community has to be engaged and that communities have to be at the forefront of the HIV response. And that communities must be empowered to play their crucial role in the HIV services, from planning to implementation. If we are to reduce HIV-related inequalities and get the responses back on track to end AIDS, key population communities must really lead the way. They should advocate for effective action, inform local, national, regional, and international responses regarding what other communities' needs, and be part of the planning, design, and delivery of the services as well. Communities must give their voice to the people who are often excluded from decision-making processes. So for effective community-led HIV responses, there must be adequate resources and support to enable communities to play their vital roles as equal and fully integrated partners in the national health and social services systems. So community-led monitoring is an aspect for the overall community engagement spectrum. So it has a very critical role in identifying and effectively addressing issues, particularly in terms of bottlenecks in engaging and retaining people along the prevention and treatment continuum for HIV. AppCom has been engaging with the CLM process under Global Fund since 2018 and has done several online CLM capacity building webinars in the last 2 years. So our work is to help to strengthen the capacity of key population networks, community members on the CLM intervention programs, and also its sustainability as well. And but without the support of regional networks and funders, programmers, and donors, that would not be possible. So to ensure that the community and community-led monitoring is truly community-led, we, together with the regional networks, community partners, are recommending the following. 1, key population and communities must be at the heart of defining what community-led monitoring is. 2nd, key populations and communities must be directly involved in leading the design of CLM. Thirdly, acknowledge the technical expertise of regional key population networks and the key role that regional advocacy play for effective CLM. And lastly, the fourth, consistently invest towards regional policy advocacy towards effective CLM. I would also like to say a big thank you again for those of you who are joining this webinar this afternoon. And please don't forget to join also in tomorrow's cross-learning webinar tomorrow that will be led by ICWAP as well. So that would be like my welcoming remarks, and thank you for your time. I'll also now hand you over to Sita Shahi, who is the regional coordinator of ICWAP, to say a few words. Sita, over to you.
Thank you, Midnight. I'm really excited because it's long waiting event that we are organizing today at the beginning point. Hello to everyone. Very warm welcome to all present speakers, audience, and community people who are joining us from distance. And thank you very much for joining us in the first webinar, which is focused on basic capacity building on CLM. And tomorrow we'll be focusing on, cross-learning, as Midnight already mentioned about it. And it's been a lot of discussion and planning among our consortium, we call 7 Alliance, to come up with this series of webinars and ideas based on the demands and suggestions gathered throughout the survey. And most of you participated in that survey as well. And on behalf of consortium and ICWAP, I would like to acknowledge the tremendous energy and contribution made from communities in last year September held in Bangkok on the that was the CLM workshop, and to ensure the momentum, that the spirit and the fire on the CLM, the regional network of PLHIV and key networks, APCOM, APN Plus, APNSW, APTN, ICWAP, NAPUT, and YouthLead, we decided to organize a series of webinars on CLM. That was the idea came from. So we are very excited to hold series of webinars beginning from today. And I believe that, a series of webinars are pivotal for all of us who are working at the ground, and to strengthen the capacity, system change, building the advocacy momentum, and to break the human rights and gender-related barriers, realizing equal rights as a community people and PLHIV. So we have not generated this idea, as I mentioned earlier, but all the gaps and demands were raised by you and the community throughout the survey. And that makes me proud to say that this is exactly the community-led is. And I'm really proud of saying it. And the idea of CLM is not only, new for the, not new for the community, but community were regularly working on it. So using different framework, maybe techniques, from since long time. From the workshop in September, where we realized that CLM being important, very important component of the global strategy, including the aspect of funders to push CLM and budget allocation at the country level as well. And I'd like to say here, meaningful involvement of community people at all cycle of CLM is very essential for us. And to do so, we really need to have unified voice and understanding and knowledge on it. To have a strong CLM, we really need to, keep our eyes on are we engaged meaningfully in the CLM? Do we? Or community at the center, are we really at the center of the CLM? Or are community deciding the works that are being held at the country level? If not, what can we do? So I'll leave this question to you all here. And I think throughout the whole series of webinar, we have 6 webinars, and what we need to be done. I mean, we really need to focus on that. And thank you very much. I think all the why these webinars were needed. It's already mentioned by earlier speaker, Midnight. And I hope the fruitful conversation and learning, not only from the presenter, but also from the country level as well, and continuing the conversation among us. And do not forget to join tomorrow's session on cross-learning and same time. Thank you so much.
Thanks so much, Sita. Yes, without further ado, I'd like to hand you all over to Shane Dickman, who is representing the US CDC in Asia. Shane?
Great, thank you, Midnight. If for some reason you can't hear me, just talk over me and let me know. So good afternoon, everyone from Bangkok. My name is Shane Diekman, and I'm the CDC agency representative for the PEPFAR Asia Region Coordination Unit, known as PARCO. So I'm the CDC agency representative, and many of you know Heather Davis from USAID, who is the USAID representative. So I'd like to start off by just saying that I'm really grateful to provide some brief opening remarks to this webinar series, Strengthening CLM Through Capacity Building, Cross-Learning, and Advocacy. Before I start, I'd like to acknowledge the leadership of the 7 Alliance, the consortium of the regional networks of people living with HIV and key populations from the Asia and the Pacific. I'd like to thank them for convening and organizing this webinar series in partnership with UNAIDS. And of course, US CDC is proud to financially support this initiative. As we know, placing communities at the center of the HIV response is critical to controlling the epidemic. And as many of you know and experience recently during our regional operation planning, PEPFAR and its new ambassador, Dr. John Nkengsong, recently introduced their 5 pillars and 3 enablers for the PEPFAR strategy. It's pretty clear that this activity and initiative for community-led monitoring, capacity building, the advocacy, the shared learning, aligns very strongly with the first 2 pillars of the 5x3 strategy, which are health equity for priority populations and sustaining the response. So to support those 2 pillars, we're hoping to do this through community leadership, which will involve the meaningful engagement in planning, community-led implementation, and community-led monitoring. And CDC is proud to be supporting the capacity building aspect of that. So as you know, community-led monitoring allows communities to design themselves design, implement, and carry out routine, ongoing monitoring of the quality and accessibility of HIV treatment and prevention services. So we need to make sure that the communities are front and center, that they're having a voice in all the activities that are going on. And then also that they hold PEPFAR and other partners accountable for HIV impacts. So you can see, I think, hopefully in the last, I would say 4 or 5 years, at least since I've been in the Asia region, communities having more of a voice in the design, implementation, and evaluation of the services that they're receiving. And this is important for many reasons, but mostly because the key populations increasingly bear the greatest burden of the HIV epidemic in the Asia Pacific region. And so it's important that the communities are leading the conversation on how to address these needs. So as far as PEPFAR, we'll continue to engage and support the unique assets, capacities, and comparative advantages of communities, KP-led organizations, women-led organizations, and PLHIV-led organizations, so we can drive meaningful, people-centered, and sustainable impact. At CDC, we're happy to be part of this process. We look forward to further working with the 7 Alliance Consortium and UNAIDS, as always, in hopes that we can make significant progress in the HIV response in the region. So with that, I'd like to close and say thank you, everyone that put this together, and I look forward to an incredible webinar series and hearing from those in the audience. I'm already seeing a lot of people in the chat, so I'm very excited. So thank you. Over to you, Midnight.
Thanks so much, Shane. Thank you to PARCO, PEPFAR, for supporting this series of webinars as well. And last but not least, I'd like to hand over to Salil from UNAIDS Regional Support Team Asia Pacific to say a few welcome remarks. Salil, over to you.
Thank you. Thank you, Midnight. It's a pleasure being here. Actually, my name is Salil Panakadan. I'm representing the UNAIDS regional office in Bangkok. I'm standing in for Bridget Quinham, who's unable to join us today. And let me start on behalf of UNAIDS to cordially welcome all to this webinar series, the first of it today, and congratulate the 7 Alliance Consortium of regional networks of people living with HIV and key populations from the Asia Pacific region, who are convening this webinar series in partnership with UNAIDS and CDC, who is providing the financial support. So welcome all, and thanks and acknowledgement to people who are organizing this. On behalf of UNAIDS, I would make a few points in the context of this meeting. And those are the macro points in terms of first point that I want to make is AIDS is not over. It is something which may sound silly to many people who are in this meeting, but when you go out in the world, there is this sense among policymakers, politicians, leadership that AIDS is over. There is this, you can treat your way out of the HIV epidemic. It is not over. There are 6 million people who are living with HIV and many more millions who are vulnerable. So we need to keep this on the public agenda so that our movement does not suffer. So that is the first point that I would like to make. The next point that I would like to make on behalf of UNAIDS is the role of communities. And CLM is a good move, but it is not everything. Community-led monitoring of the HIV response is great. It has the funding, it has the attention currently, donors, technical partners, and all of that. But then we need to go further. And to me, a good target to achieve, which is in the global AIDS strategy, is the 30, 60, 80 targets. And without that, there's no way the communities will remain central to the response to the epidemic. The CLM is about accountability, and that is what we are teaching ourselves, how to do this monitoring properly, scientifically, and credibly. And it is important that the stakeholders acknowledge the role that we are playing as communities to monitor access that people are having for HIV services. And in that context, it is important that we as communities and people who are supporting the communities own our own data and the results that come out of this monitoring efforts, in the sense that this is taken up as one of the main channels through which accountability is ensured, through which monitoring in the larger context of the global AIDS response is taken forward. So in that context, it is very important for us to look at quality, the credibility of our data, the sincerity with which the entire effort is led and implemented on the field. And in that context, it is great that these series are being organized by the 7 Alliance, which is fantastic. And that is what we need to do. We need to be on top of things. Finally, to conclude, I would also suggest that in the context of Asia Pacific, it is a key population epidemic. And when countries look at solutions in the context of universal health coverage, UHC, they often tend to forget the needs of key population, especially prevention needs of key population. And that is something we need to always be aware of, to keep that on the upfront in terms of, it's not enough just to provide treatment and PMTCT services. There is this prevention thing, and that often gets neglected in the context of countries achieving UHC through insurance schemes and so on. So that is something we always need to keep up and center. And in this context, CLM is a critical way. As CLM is rapidly being rolled out in Asia and the Pacific, we encourage all of you, all of us, to maximize this opportunity and to learn from each other. I think the next tomorrow's thing is about learning, cross-learning, and also continue as we move forward the implementation of CLM. Finally, to conclude, once again, we congratulate the organizers of this webinar series, and we at UNAIDS are happy to be part of this process, and we look forward to further working with the consortium, US CDC, and other partners to take forward not only CLM, but the larger context of community in the HIV response. Thank you very much.
Great. Thank you so much, Salil. And thanks so much, everyone, for joining. If you don't mind, if we can take a group photo of everyone who's joining us here. Currently, we have like over 70 participants. So I think it would be great if you are able to turn on your camera. Look at the screen. And then we can take a group photo. That's okay. And then I will count to 3, and then people from the AppCom team can then take photos. And Martin wanted to take a few photos because we need to move from different screens. But please ensure that you're looking right at the camera and not look at yourself on the screen. So look at the camera. 3, 2, 1, smile. Okay. And then second page. 3, 2, 1, smile. And then the third page. I think some people are not looking at the camera. You're looking at yourself. 3, 2, 1, smile. Great. Thanks so much, everyone who's come on, have your camera on for the photo. And then without further ado, I'll hand over to Katie, who will go through what expectations for this webinar is. Katie from APNSW, over to you. You need to unmute yourself.
Yeah, I did. Yeah. Thank you, Minai. Welcome to all of you, wherever you are. Good morning, afternoon, and evening. And my name is Katie. I'm from Asia Pacific Network sex worker, and I'm working in HIV response and human rights or sex worker. In this July will be around 20 years. Is this also that this is exciting for the webinar that APNSW is being one of the regional consortium member to support this capacity building webinar, which is led by the EPCO and together with the other key population network. On behalf of the member of the APNSW, I would like to thanks to everyone who joined us in this webinar, and also the thanks to CDC for the funding supporting through the UNAIDS IST. Which is without this support, and I believe that we could not do a lot what we are doing now. And purpose of CLM is that at the regional level, we key population network have instead that our engagement work in the CLM intervention programming for the key population and community who we serve. It is quite evident when we have conducted the following activity. In 2022, the CLM workshop, which was led by the all key population network. At the time, we did not name yet the 7 Alliance with the support and in partnership with the UNAIDS. In the 2023, we have drafted the CLM roadmap, and which will be implemented and rolled out soon. And also our work engagement for the CLM intervention programming will be the continue to ensure the key population community are supported and empowered through our joint effort. Based on the needs of the result from the recent CLM survey and building on the action step from the regional workshop in 2022, we have designed this capacity building and cross-learning webinar series. I'm so glad that our key population community are leading on that. And the overall purpose of this webinar is also the strengthening the capacity of key population network, PLA Chinese community, and build the strong and sustainable CLM mechanism at the country level. And this webinar will be also provide a space cross-learning, which is my colleague and my brother and sister already mentioned that. Among the different partner of the HME response to generate buy-in for the CLM as the critical tool to empower community and improve the services, ensure that they are accessible of the quality and acceptable and respond to the people needed, and conducting to the CLM for the HIB. HIB is essential and accountability mechanism for the quality of HIB response, led by implement by the key population community-led organization, which is the sex worker community, men who had sex with men, people living with HIV network, and then the other key population, other affecting the group of the community entirety. And then through the joint effort of the regional network consortium, we have regional network through this webinar series want to ensure the priority and prioritizing other first. The key is the first key is the meaningful involvement of community in the CLM, and key population should and must drive and lead the implementation of the community-led monitoring from the design of the tool to presenting of their result. The secondly is the ownership of the key CLM, which is also the key population should and must own the CLM intervention programming, which unlimitedly will they contribute to the CLM sustainability. The third is the buy-in from program implementation. Key population should contact effectiveness advocacy and by owning the CLM intervention programming for the buy-in of CLM by the stakeholder at the country level with the community. And I include that my expectation and also that I hope many of the community are also the same, that we are expecting that this CLM webinar will be the learning by doing, and also we can participate in the meaningfully to achieve and sustain our movement. Thank you.
Thank you so much, Katie, for giving us the background and purpose of this training and expected results. Now let's move on to the setting the scene, and I'd like to invite Francis Joseph of the NAPUT to give us a background on what is CLM for communities.
Hi, Midnight. Thank you so much.
Thanks, Francis.
Is my slide visible on the screen?
Yes, we can see. Yes.
Yeah. Thank you. Good morning and good afternoon to everyone. My name is Francis Joseph, and I'm the regional coordinator of the network of Asian people who use drugs. And I've been, I've been part of this community-led monitoring. And here, in the next 10 minutes, I'll try to consolidate our responses, or what we have as the regional key population network consortium, the work that we have done, with a little understanding briefly about the CLM for communities. As you can see on this slide, we have actually the snapshot of key populations in Asia, and this is just a little breakup of each key population group, and you see there are about 8.5 million people, men who have sex with men, and 5.2 million sex workers, people who inject drugs are 2.7 million, 471 transgender people. Young people, we do not have the data, so people living with HIV are almost 6 million, of which 370,000 people are young people. So Asia is the home to a large number of key population, as well as those living with HIV. There are no specific numbers, as I've said, but I just want to highlight here is that we as the key population networks are not just numbers. But the idea of starting the slide presentation with these statistics is to inform everyone on the regional scenario. and a consolidated idea about the key population groups in the Asia Pacific region. Now, talking about CLM for communities, we have the community of communities, MSMs, sex workers, people who use drugs, transgender people, young people. And we have a service facility which provides us the services. We have service providers who specialize in healthcare provision. And here we have our accessibility, which is the AAAQ model. And this AAAQ model is availability, accessibility, acceptability, and quality. I will just briefly talk about the availability. That availability is to ensure that the services are existing and the commodities are provided. So much have, the services must have sufficient quantity for their functioning. Accessibility is a little broader. It should be physical accessibility, that the services are located at a reasonable distance. Financial accessibility looks at the aspect whether the services provided are free or are they paid. And if they are paid, whether the services are reasonably manageable by the person accessing the services. Third is the administrative accessibility, whether there is some kind of a registration that is required when a person from the key population group has to provide some document such as a national ID card or a bank account detail or a phone number, etc. Social accessibility is that which sees into the aspect that the service providers are non-judgmental and non-discriminatory. The last aspect of the accessibility is about the information accessibility, whether the information that is provided is in the form of an electronic media through social media channels, etc., or they're provided, through a print media or a folk media, etc. So the third A, which talks about acceptability, whether the services are designed to respect the relevant ethical and professional standards. Do service providers respect confidentiality and informed consent? And lastly, the quality of services, whether the commodities that are provided are in good condition or do they have an expiry date? And the service providers who are providing these services possess the relevant skills and have the right approach and attitude towards people who are availing the services from these people. Yeah, and the entire process under the community-led monitoring is, of course, monitoring, evaluation, and further learning. So I hope this is clear. Relevance of CLM for communities is community-led monitoring is an approach that empowers community to actively participate in monitoring and evaluation, including the development of projects and programs that directly affects them. It also involves project implementers or service providers accountable for their actions. The key principles which actually, talks about are participation and engagement, where the CLM emphasizes the active involvement of community members throughout the monitoring process, as I said earlier. The communities are engaged in data collection, analysis, and decision-making, ensuring that their perspectives and priorities are considered. The second aspect of the key principles is empowerment and capacity building, where CLM aims to build the capacity of community members to effectively monitor and evaluate the projects. This involves providing them with training, with tools and resources to gather data and to, to analyze information and communicate their findings. The third is transparency and accountability, where the CLM enhances enhances transparency and accountability by promoting open and accessible information. And the fourth aspect is advocacy for social change, which, like, CLM goes much beyond monitoring and aims to bring about broader social change that includes that by empowering communities, we are enabling the communities to advocate for their rights, demand improved services, and influence policy decisions. So overall, CLM strengthens the voice of the communities, enhances local governance, and contributes to the overall effectiveness and impact of development initiatives. So the engagement of the regional networks on CLM is that the Regional Key Population Network Consortium has been working closely with the UNAIDS regional support team in Asia Pacific region. The idea behind the collaboration was to empower communities and leading them as not only service beneficiaries, but to keep a close watch on the quality of services which is accessed. A CLM mapping exercise was carried out in 8 countries in the Asia Pacific region in early 2022, and multiple efforts have been put in thereafter towards formalizing the CLM through rigorous on-ground brainstorming and consultations between the consortium partners, UNAIDS, and a few consultants. These series of consultations led to the development of a 5-year roadmap. This 5-year roadmap has 4 key pillars, which is a strengthening of the consortium. The first pillar.
Online session चल रहा है CLM पे, उस पे online पे हो जा.
Hello, am I audible?
Hi, you are. I think if you're not speaking, can you please mute yourself? You can continue, Francis.
Yeah, thanks. The first pillar, as I said, is strengthening the Regional Key Population Network Consortium in itself. The second pillar is the Regional Community Watch, which is also the Asia Regional Observatory, which requires constant monitoring, timely evaluation, and learning throughout the process. The third pillar is the capacity building, and fourth is the advocacy. We also had developed a community-led monitoring framework where a set of recommendations came in, and these were crucial to the regional key population, to the consortium, to adapt these tools, customize them according to the Asian context, and put them into implementation. With reference to the successful initiation and completion of the regional network meeting that was done in collaboration with the UNAIDS RST in September 2020, the meeting saw about 8 country representatives from Cambodia, India, Indonesia, Laos, Nepal, PNG, Philippines, and Thailand. And there were a few takeaways from that meeting that are here. So basically, these were takeaways on which we have worked. So forming a community of practice on CLM, strengthening of information sharing that could be achieved through development of a repository of information, and further convene a regional stocktake event, and nurture a range of strategic partnerships that focuses upon national community of practice between government stakeholders and RKP communities. Tell the CLM story. So this is a kind of a, having a substantive focus on areas linked to the progression matrix that could cover specific areas such as stigma and discrimination, beyond treatment, upstreaming, ARV treatment stockouts, other treatable diseases affecting key populations, and engaging donors in using so that they could use their diplomatic voice and influence the governments, and also reaching out to the wider donor community. So the focus was on the Global Fund Grant Cycle 7 or the GC7 and the PEPFAR COP ROP, and also foster domestic resource allocation. There were some more, it was also discussed in the regional meeting to adapt. to
Francis, can you
Yeah.
please speed up? You're very behind, we're just very behind time.
Okay,
Thank
okay.
you.
So these were the considerations that came up in the last meeting, which was held in September. So we have actually zeroed down on 3 key areas, which is capacity building, development of a regional observatory, and advocacy. So this is one aspect of the capacity building where we are doing webinars of community-led monitoring. There is also a training package which is in development, and we'll be doing TOTs for regional network members for providing TA at the country level to enhance their skills, knowledge, capacities. The regional observatory is to keep an update on the progress, a dashboard, which is a repository of information. We'll be doing a client satisfaction survey, a progression matrix, etc. And advocacy, the learnings which comes out from the regional observatory or the information gathered can lead to development of country advocacy plans and build the value of CLM and integrate, and our focus, our thrust will be integration into the national strategic plan. We are aiming to conduct an impact evaluation of the CLM implementation in due course of time when things are falling in place. And thank you so much.
Thanks so much, Francis, and apologies for having to speed you through your presentations. I know there's a lot that's happening at country and regional level. And I think for the participants, if you have any questions, please feel free to type them here. And as Francis mentioned, we are also very grateful to have the Global Fund joining us, particularly when we're also looking at how does CLM fit into the Grant Cycle 7. So I'm pleased to invite Rain Cortez from the Global Fund. Bonjour. Rain, thank you for joining us. And let's see how we can integrate this within the Global Fund Community System Strengthening Framework, and also particularly on the Grant Cycle 7. Thank you, Rain.
Bonjour, midnight. Hello, everyone. Mabuhay. I'm Rain Cortez, and I work with the Global Fund with the Community Rights and Gender Department. I work with a small CLM team of 3 people, together with Kit Minis and Susan Perez, and privileged to speak on behalf of the Global Fund about community-led monitoring. And I would just like to congratulate 7 Alliance. The regional networks are always close to my heart, coming from regional networks myself. So my presentation will be framing on where community-led monitoring falls inside our community system strengthening and community systems and responses framework. Next slide. As you know, the Global Fund strategy has recently been renewed or improved, covering for the next 5 years, and similar to other technical agencies, CDC, PEPFAR, UNAIDS, we all see the importance of community health and its importance to achieving global health and global goals. And the Global Fund and the strategy that we have for the next 5 years heavily involves the crucial role of communities in achieving this strategy. And as we know, communities, vulnerable and key populations definitely are part of delivering services in different settings that formal health might not be able to access. And also community health workers in their broader sense can include different public health sector employed workers, including peers that may be coming from CLO or CBOs. And we need to think that this should be complementary between the different cadres of community health workers. And this is essential, as you can see that CLOs and CBOs have a crucial role in this provision of community health services. And in order to provide health or to strengthen health systems, definitely community level service delivery is also very critical. And this has been very evident in the recent experience with the pandemic of COVID-19. That's why, as you can see in this strategy, there is an overarching evolving objective relevant to how communities plays a crucial role in pandemic preparedness and response. Next slide. I would just like to tackle to clarify two relevant terminologies, which is community-led and community-based. And as you can see in here, the message that we are imparting is that community-led and community-based responses are complementary. By definition, community-led responses are programs and services independently managed by community-led organizations. For example, key populations leading the organization, and they're independent of funders, donors, etc. And community-based responses are programs and services, may or may not be led by community, but they are programs and services located in a community setting. And as you can see in this overlapping circles, both these interventions contributes to community systems and responses, and they may be community-led and or community-based. And examples are, for example, of community-led responses are, these are programs that were funded by government or funders, but it is totally managed and directed by community-led organizations such as CLM, advocacy, research, or even policy work. While community-based responses, examples are health outreach, education, and health support services. These are directly done or provided by community organizations in collaboration and in partnership with government agencies who provides funding and oversight. But what we need to know in here is that they are complementary. We're not picking one over the other, and definitely community-based and community-led responses depends on the country context as well. Next slide. As you can see, community systems and responses in our broader framework consists of two parts. One is community responses, and the other one is community system strengthening. So what are community responses? Community responses are delivered by community-led and community-based organizations within, partially, or completely outside the formal health system. So as you can see in the diagram, there are community responses that are formalized or fully recognized by health systems, such as community health workers or integrated community case management. But there are also community responses that are partially captured by health systems, such as community health education, health commodity distribution, and adherence to ART support, even home care support as well. But there are also community responses that may not be part formally of health sector, but are complementary services such as human rights, stigma reduction programs, community-led social accountability in terms of monitoring, for example, maybe budgets on how funding is being used. So as you can see in here, in this spectrum of community responses, these are basically how you provide the services. And community system strengthening approaches, which is the other component, needs to be adapted across this different spectrum of community responses. Next slide. So the second part of CSNR, which is community system strengthening, these are a set of 4 interventions that are used and are recommended to improve community responses, which was shown in the previous slide. And these 4 interventions includes, of course, community-led monitoring, community-led research and advocacy, community engagement linkages and coordination, and community building and leadership development. And as we know, CLM is, we really advocate for the inclusion of CLM in Global Fund grants, especially at the stage of grant cycle 7, that we are still in the funding request stage. wherein we make sure that the use of CLM data is used not only for advocacy to improve services, but even used to advocate for better inclusion and better programming for community responses in global fund grants. And this community-led monitoring data should be used side by side by other community-led research and advocacy undertaken to, for example, look at barriers to services. And all of this data, in a sense, or evidence, in a sense, can be used for further advocacy, not only for changes in service improvements, but also for policy reform. But at the same time, given that CLM should be implemented and should be led by an organization, capacity building and leadership development is very important. So we recommend focusing on key and vulnerable populations to lead CLM and other community responses. But at the same time, it's important that community-led, community-based organizations have greater capacity for community engagement and linkages, because it's very important to link community level service delivery to broader public health sector services or other referral to other services as well. Next slide. So there are two key resources that we recently updated, which is a technical brief of community system strengthening and a guide or decision-making guide for how to include community system strengthening interventions, which of course includes CLM. And we highly recommend communities who are involved in global fund process. We already finished window 1, and we are currently in the process of window 2 submission for funding requests of the global fund. And definitely these resources are very useful in your country dialogues, in your country consultations, and even when the funding request is approved, it's very important in grant making stage, and furthermore in implementation as well. Next slide. This is just a more extensive definition of the 4 different priority interventions. Francis already explained what community-led monitoring is, and definitely it's an accountability mechanism. It's generally looks at AAQ of services and the impact to, for us, HTM or HIV, tuberculosis, and malaria services. And as you can see in here, if you read through the definition, they are complementary to each other. They are mutually reinforcing each other. That's why when proposals are accepted, we really need to see that countries propose in all 4 of these CSS technical areas, because one intervention definitely needs the other components for it to work as a more seamless and more cohesive and more comprehensive CSS program. Next slide. I highlighted community-led monitoring in here just to highlight how communities and the countries decide on how to integrate community system strengthening into their fund proposals, or even reviewing your programs as well. So definitely the CSS decision-making guide will help you understand first and compile community inputs on what are the key issues. For example, why are we including community-led monitoring? Because country programs for HTM have issues in AAQ of services. And definitely, if that is an issue in the country, potential priorities are automatically developing CLM strategies or developing CLM indicators or community capacity to share CLM data. And it depends on the maturity model of a CLM in the country. It might be more on strengthening. In other countries that are more evolved in their CLM program, the issue might be, how do we really bridge the gap between the use of data for CLM towards advocacy and really making changes? So this is one step that is important to understand why you're including community-led monitoring. Next slide. And once you understand—
Sorry, Rain, are you wrapping up?
I can wrap up.
Please, thank you.
So in this one, it's definitely a description of CSS activities for community-led monitoring. It's similar to the last slide about what are the different potential activities, like developing frameworks. It also includes technical support for CLM implementation and even the actual piloting and implementation. And of course, there's a corresponding cost associated to it. Next slide. But what is important in including CSS is to determine and to know the value for money and what is the impact that CLM data brings. And definitely CLM data that is generated helps us to helps managers and service providers to improve their programs, but it also empowers the communities because they hold and own the data to contribute to intended health outcomes and gender-related and human rights-related barriers. Next slide. Next slide. Just to add, as you know, that Global Fund has also been supporting C19 or COVID-19 response mechanism grants. But as you can see in this framework, that community-led monitoring and community-led mechanisms that has been existing now is being recommended to evolve towards pandemic preparedness. So as you can see in this slide, we see future community-led monitoring mechanisms, not only doing their usual AAQ monitoring, but also to contribute how they will contribute to health system strengthening and to pandemic preparedness, as you can see in the different slides. So that is also a recommendation for many countries to start thinking about CLM mechanisms to be ready to be used as a tool and a mechanism to contribute to pandemic preparedness. Next slide. This slide, I'm going to skip this one, but this was mentioned and this will be dealt in detail in the later session. But there is a guide that was developed and supported by the Bill and Melinda Gates Foundation through the International AIDS Society. So there is a current guide for how to include community-led programs in your HIV, tuberculosis, and malaria programs. And this is available online, and communities and countries are recommended to use this. Last slide. Aside from the guide to include CLM in the Global Fund funding request, there are also a plethora of community-led monitoring resources developed by technical assistance providers. This is not an exhaustive list. These are ones that are recently supported by the Global Fund. It tackles different issues that is concerning the CLM cycle or even other issues that needs to be addressed in doing the CLM program in many countries. So you can access all these slides that was developed by our colleagues from ITPC and from HealthGap as well. Last slide. So that's all. So I hope you find it useful and the resources so you can contact our team of CLM team for guidance better and to inform you that we are still providing technical assistance support to many of the countries that has implementation of CLM in their grant cycle 6 implementation grants. So just reach out to us on how to be able to access this technical assistance support. Thank you.
Excellent. Thank you so much, Ray. And I know you have so many resources that you're also sharing with us. So for those that are online, we will make these public for the slides. So don't feel like you won't get those information. I will come a bit later. Thank you, Rain, for also noting that there is no difference between really in terms of the community-led monitoring about the CLO and CBOs. They're both not mutually exclusive, so we can all work with each other and ensuring that at the end of the day, we want to ensure about the accessibility, the quality, particularly for our region, for key populations. And of course, having someone from the regional networks are also now working within the Global Fund. I think that's great. You already understand the needs from our communities from our region. So we'll look forward to working with you more on this as we implement this with the 7 Alliance as well. And then lastly, just want to, for the overview, I'd like to invite, really crucial person in terms of being able to work with all of us with the 7 Alliance, Michaela from UNAIDS RST to give us a bit of information about the landscape of the CLM in the Asia Pacific region. Michaela, thank you for waiting.
Thank you, Midnight. So I'm gonna share my screen right now. Can you all see my screen?
We can see your screen, but you want to show your slides. I'm seeing myself and you on the screen.
Okay. 1 second. Okay, should Does it work now?
Yep, you just need to put this on the, yeah, great. Thanks, Michaela.
Perfect. Thank you, Midnight. I apologize for this inconvenience. And thank you so much, everyone. It's a pleasure to be with you this afternoon. This is Michela Polesana from UNAIDS Regional Office based in Bangkok. And I'm working with the 7 Alliance on the CLM work together with all our great leaders that are here with us today. So before I start sharing about the CLM landscape in Asia and the Pacific, I would like to complement some of the slides that Rain has already presented. So I would like to give the framework and how CLM falls into the political declaration on HIV and AIDS and the broader context of the global AIDS strategy. So we may all recall that when the political declaration on HIV and AIDS have been endorsed, UN member states have committed towards a set of ambitious targets that need to be reached by 2025 to be able to end AIDS as a public health threat by 2030. These ambitious targets include the following. 30% of testing and treatment services have to be provided by community-led organizations by 2025. 80% of HIV prevention services for population at high risk of HIV infection, including for women within those populations, have to be provided by community-led organizations by 2025. And 60% of programs to support the achievement of social enablers to reduce stigma, discrimination, address human rights, and reduce gender-based violence have to be provided by community-led organizations by 2025. And here we link this with the definition of community-led responses. And Rain has already provided a very comprehensive definition. So I just want to summarize it and say that community-led responses are determined by and respond to the needs and aspirations of their constituents, the communities. Community-led responses take place at global, regional, national, subnational, and grassroots levels and can be implemented virtually or in person. Community-led responses also include different categories, which are advocacy, campaigning, and holding decision-makers accountable, monitoring of policies, practices, and service delivery, and this is where community-led monitoring comes into play, participatory research, education and information, service delivery, capacity building, funding of community-led organizations, etc. And now let's look at the different pillars of community-led responses and how they are linked to the targets. For example, we see that community-led monitoring and research is directly contributing to the 60% target through evidence-based data that is collected through community-led monitoring, as we said, but also through other forms of community-led research, for example, stigma index, youth scorecards, budget monitoring, etc. So having said that, we really see the importance and the value that community-led monitoring has to contribute towards these ambitious targets that will lead us to the end of AIDS if they are achieved by 2025. And now let's move on to the CLM landscape in Asia and the Pacific. This is based on a mapping exercise that we have done in 8 countries in early 2022, also with the collaboration and support from the regional network of key population. What I want to say is that CLM is moving really fast and is evolving really quickly. So the information that we gathered in 2022 has already evolved, and we are seeing already important updates and developments since our data collection at that time. But I will go through some of the findings, and I think this is good food for thoughts to also hear what is happening in your country, how this has evolved, and how you are involved in all the different CLM projects that are ongoing. So what we found is that the CLM projects are being implemented in the region through a variety of CLM models and approaches. When we did the mapping, we noticed that these projects were all at different steps within the CLM cycle. So in some cases, we saw that the country or the different organizations were preparing to initiate a CLM intervention. In other cases, data collection just happened. In other cases, advocacy and the joint problem solving had already been concluded. But what we have seen in general was the region was moving at different paces and also were at different steps of the CLM implementation. Also, something that has been mentioned by Sita at the very beginning is that CLOs of people living with HIV and people from key population have already a wealth of experience and background in conducting community monitoring before CLM was introduced as a concept. So, for example, we see a lot of experiences community-based monitoring, but also other type of community research, for example, stigma index, youth scorecard, just to mention some of them. Data collection and analysis, including survey questionnaire, focus group discussion, and key informant interview guides have been developed in different countries for CLM implementation. Also to mention that the cross-cutting scope of CLM that we have identified includes availability, accessibility, affordability of HIV prevention and treatment services, and also human rights. In some countries, consortiums or task forces of key population PIL-HIV have been established to lead CLM implementation. And there are already examples on how CLM findings have been used to identify joint problem solving and to lead to corrective action to improve access and quality of HIV services. I also want to go through the CLM complexities that we have identified at that time. First of all, different approaches of CLM. So it was stressed that different countries do not have a single CLM systems, although most of them were moving already towards that. And there were different tools and approaches and models being used. Here I want also to specify the difference between harmonization and standardization of approaches that was stressed by several participants. Harmonization is the critical aspect. Meanwhile, standardization is not the way forward. So it was stressed that one-size-fits-all framework for national rollout may not work for all groups of people living with HIV and people from key population. So while we want to move towards harmonization, it's important that CLM allows us to understand the different needs and aspects of all the different groups. Moving on to the next complexities around community leadership and ownership. So overall, it was stressed that leadership and ownership of community-led organization in CLM remain to be strengthened and must be enabled from the outset of the CLM projects. There were some barriers that were identified that are limiting engagement or ownership in CLM. These included, for example, exposure to capacity building, where it was present since the beginning or where all the groups were able to access, training for CLOs, but also the availability of funds. For example, it was stressed that lack or frequent turnover of staff, limited operational functions, and limited funding for community-led organization represented some of the barriers that limit the engagement of CLOs in CLM. For example, some community-led organizations lack sufficient office staff to become involved. And as I said, it's important to hear also your feedback in relation to these initial findings from last year. Then it was also revealed that there are different understandings of CLM. There is no collective and unified understanding. CLM is not fully understood by all key stakeholders, especially from some government representatives. And also the implementation of the CLM principles differs on the ground. So there is a difference between theory and practice, and communication around CLM implementation at all levels need to be improved. And this was mentioned by Francis. We have used these initial findings to work on the plans for the work that we have been doing since last year with the CLM workshop and now with this series of webinars. Another critical issue that has been identified is the sustainability of CLM. So we recognize that there are different international donors, such as USAID, CDC, Global Fund, supporting CLM, and also in some countries we have DFAD through UNAIDS. But the long-term funding modalities, especially domestic funding, and for the sustainability of CLM is an issue. Some factors that could help sustainability of CLM in the long term were identified. And here I'm going to list them. The first one is the integration of CLM, especially CLM data, and the use of CLM data for program improvement. However, it was revealed in some context that there is still hesitancy from some decision makers to link CLM data to national information systems to guide decision making. Another important factor is the continuous technical support and capacity building for community-led organization to ensure that they are the driving seat of CLM. Also, another aspect is the importance of identifying diversified source of funding at global, but also national and local levels. And also to continue to advocate for the inclusion of community-led monitoring in the context of GC7 and PEPFAR processes. In addition to the
Michaela,
challenges,
apologies to interrupt. Can you please speed up? Yeah, we are a bit behind time. Thank you.
Yes. I'm going to go through the enabling factors very quickly. So some positive aspects that create opportunities for CLM. So what we have noticed is that there is buy-in from national and local governments on the value of CLM for improvement of HIV services. For example, in Nepal, the government is engaged in the national CLM task team, and at district level also through the CLM task teams. Funding support from international donors is available. Collaboration between community-led organization, government, EA providers, and donor has been seen in different contexts. And also the opportunity to institutionalize CLM in the context of national HIV responses, for example, in Cambodia and in the Philippines. Some recommendation, I will go through them quickly, and then Midnight can share the presentation with the audience. Some recommendations: strengthen CLO expertise on CLM to expand the leadership and transfer ownership of the community to community-led organization of CLM, including in defining indicators and prioritize sites for CLM. Promote a unified CLM system, strengthen data tools and systems, strengthen advocacy of CLM results, and this is where in particular community-led organizations express their needs for strengthened capacity building, facilitate integration of CLM into national HIV responses, and mobilize resources for CLM sustainability. Here, the work that has been done at the regional level, led by the regional network, and Francis has already gone through all these important activities. And then just to share some of the impact that the regional CLM efforts have, especially with a trickle-down effect at the country level. So regional network capacity on CLM is important to continue to provide support to community-led organization at the country level. GC7 processes are using CLM-generated data to inform funding request development. Cross-learning and cross-sharing are extremely important, and this is going also beyond the Asia and the Pacific region. And mapping exercise and the work that is being done is also supporting follow-up action, including some concrete example in some countries. And that's it, Midnight, from my side. Happy to share my PowerPoint and continue the discussion.
Thank you so much, Michaela. And I do apologize for also rushing you through the PowerPoints as well. Yeah, I know that we already having allocated 180 minutes for this webinars, and I think if there were more funding, we could have got everyone here together for a full day's discussion. I do apologize that there might be some details that is being missed out, but we have to move on and push on. As I said before, the presentations will be shared with those that are joining us this afternoon. I now would like us to move ahead in terms of the framework of community-led monitoring and learning from what ITPC has been doing. I would like to welcome Yelena Bosinovsky to present on opportunities on how we can use this. Yelena, thank you so much.
Thank you very much. Thank you, Midnight. Do you see my presentation?
Yes, you just need to put this into presentation view, and then that's it.
Perfect. Thank you so much. So I hope the gods of the internet in Malawi will be merciful, because it's always a little bit tricky. I'm based in Malawi. Hi, everyone. Very nice to be with you here together. And it's been very insightful what we've heard so far from my colleagues, Francis, Rain, Michaela. And I don't want to be too repetitive, because there are some points in my presentation that can maybe sound repetitive. So I will be trying to move forward and be as specific as possible. My name is Yelena. I'm working for ITPC Global as a community data and advocacy manager. ITPC Global, I will say a little bit about us, and then I will focus on CLM. What is CLM according to ITPC extensive experience in implementing CLM as a technical assistance provider, and also direct implementation of CLM. Then definitions of CLM have already been covered. Like Midnight said, you will all have access to this presentation after the fact, so you can always come back and you can always reach out afterwards. And then I will present ITPC's circular model of CLM, which we find very useful in practice with the tangible results, which is of course what we're all looking for, impact and results. And then a few examples, a few case studies of successful CLM in practice, because I've noticed with CLM there is a lot of theory, but it is good to actually see what has happened in different contexts, because we have already heard about the maturity of CLM in Jamaica, for example, and Burundi would not be the same, or in South Asia Pacific, in Latin American, Caribbean. So it's good to see this type of comparisons and maturity levels. And like Michaela already said, there is no one-size-fits-all solution. But we do what we can, the best on the context. Rain already went through the GC7, most of what is relevant now, Grand Cycle 7. We just wanted to point out from the technical assistance perspective and some of the deadlines to keep in mind. And yes, our resources, which I will share in the end. As I say, ITPC is an issue-based global activist network. We've been around for more than 20 years, worked all around the world. And we have different regional offices, but I'm part of the global team. And we have many regional offices, as you can see from this slide. As someone already mentioned today, CLM is a science-based accountability innovation that puts communities first. I personally really like this definition or a line. Science-based is a fact-based, as we always like to say in ITPC. It's about fact-finding, not fault-finding. So we are finding the facts and not pointing the fingers, in order to keep duty barriers accountable. And in a way, as also someone says, it's not an innovation because it's been de facto around, but in last couple of years, it's been more of a hot topic, and which is good, putting communities on the front line in leading these initiatives. So more often than not, I find it also useful to say what community-led monitoring is not, as opposed to what it is, because then we can maybe make a parallel and differentiation. So what it is not, it's not monitoring people by the government or any other groups. It's not health services providers carrying out their own monitoring project to support the recipients of care. It's not a parallel monitoring system, M&E system, to the government monitoring and evaluation that already exists. So it's different than that. And it's also not donor driven. It's not donor filling their data gaps when they're collecting the M&E data. And it's not only data collection, because quite often we can see that people are focusing only on qualitative and quantitative data collection. And, as also we have already heard today, importance of phases of CLM and respecting all the phases of maturity of CLM is critical to successful and quality CLM implementation. So data collection leads to evidence, leads to engagements, leads to advocacy, leads to impact, a change for a problem that we have as a community identified. So it's not just data collection. And it's also not a snap of data in one certain period of time. The fact that we are routinely monitoring the data collection over the issues that we find very important, and this frequency of the same data collection over the period of time is very important as well. So it's not just a snap of data. And it's not a quality improvement initiative like when we go to the healthcare centers and we have also at the airports those smileys, are you happy, are you not happy with a service, with the service that's been provided. So that's also what is not. But what CLM is monitoring of services by communities, like we all said here a zillion times, is a community ownership or recipients of care, if you're talking in the public health sphere. And we talked about same data being collected and measured over time, over the period of time. And then indicators or issues that we are actually monitoring are those ones that are important to the communities in order to get the service improved, to get the problem dealt with. So those are relevant to communities. Quite often we say, if you want to measure, if you want to kind of see if the activity is CLM or not, you can ask a question. If we want to change an indicator, who is to be asked? If the response for that is the donor, then that's not a truly CLM activity. So the communities are the ones who are determining if we want to change an indicator, because that's what's relevant for them. And this monitoring is providing the evidence base for advocacy, as we says, which is bringing us to the impact, which is the ultimate goal to make a change. So this is from the ITPC lengthy experience, as we like to say. It's a process where communities take the lead to routinely monitor issues that matter to them. And then they work alongside the policymakers to co-create solutions for the problems that I've identified. So in a way, when you have policymakers who are sensitized about the benefits actually that community can bring to the table, because that's quite often not the case in many contexts, as we know, because communities are seen as a as a watchdogs or other terms that the government don't like, the Ministry of Health doesn't like to hear. So, but when we have this consensus about CLM, then it's basically a win-win process, because it's between duty barriers and communities, and that's what we are striving for. definitions we already heard, different stakeholders, different definitions, but there are some common denominators within all of the definitions that we heard today, and some of them we have not heard today, and that's community ownership. So community-led, as we said, community ownership. It's a community that is organized. So it's organized community. It's not kind of spontaneous. It's organized for effective monitoring. And the ultimate goal is enacting change and assuring accountability. So these three elements we see as being present in all of the definitions. I'm going to go through quickly through the ITPC kind of skeleton structure of CLM, which is the circular model that we like to emphasize, because you cannot accelerate CLM. You cannot, even though we sometimes have requests, can you do the CLM in 6 months? We need CLM data collected, again, by donors, but that's just not how it works, especially in some sensitive contexts. So that's why we always like to start with education. So CLM can, in that sense, take time, especially if the context is not, it's quite sensitive. So we all know knowledge is power. So this is the science behind the disease. This is the normative standards. Do key populations even know what are they entitled to? Do they have this knowledge? So we do this in that way. First, awareness raising, education, to learn what is the science behind the disease. And after that, after we go to identifying the gaps and issues, and then we can select the right indicators in order to collect the data, in order to collect the evidence, collecting the qualitative and quantitative at the same time, because we don't want only numbers and percentages. We also want qualitative story behind the numbers. And there we have the evidence, which is critical to engaged in the community groups where somewhere there exists. They're called community consultative groups, where we bring the data we've collected and convert it to the arguments, and then we go to the advocacy efforts, and then following up, has this actually made an impact? Has this made a change? So that's why this process and following the circular, we find it very important, and not just focusing on data collection and then nothing. Rain already shared this importance of services that we actually what are we actually monitoring? What the services that are sufficiently meeting the needs of the key and vulnerable population, as also, I think Francis already mentioned, availability, accessibility, affordability, acceptability, and quality of the services. Not going to go into details, again, referring to a very useful guides issued by International AIDS Society, where you can find how to actually include CLM into your projects. And now a few practical examples of what ITPC has done. We have our citizen science project. I think my colleague Chalpa is here also on the call. She's leading that project, and we've implemented CLM in 2 countries, in Malawi and South Africa, in 3 districts. These are just some of the numbers: 29 health facilities, 58 data collectors engaged, almost 900,000 beneficiaries, 1 year of continuous monitoring, like we said, the routinely monitoring, a lot of qualitative and quantitative data collection methodologies, and then some of the conclusions that we actually found out after this 1 year, which was from October 2020 to October 2021, that expansion of multi-month dispensing of antiretroviral therapy has been increased during the COVID time, and that one of the reasons for that is that because stockouts were very, very quickly resolved. This was, for example, case in Malawi, and that the main factor delaying the further scale up of the 6 months spells was not whether the stockouts occur, but how quickly they are resolved. And then in some other case studies, sorry for my accelerated talking, I'm just trying to go through the slides, and you can always come back to this information or ask us if you want more questions or more proof of the case studies of the CLM. For example, in Cote d'Ivoire, thanks to the CLM data, the Ministry of Health has eliminated the user fees that they were charging. For example, in Malawi during COVID time, thanks to the data collected with CLM, then the Ministry of Health actually approved the expansion of the working hours for the public hospitals, which was one of the issues identified with CLM. You can read further examples. For example, in Zimbabwe, then CLM data was used to reduce the duration of stockouts because they were very reliable, quantifiable, relevant information presented with the CLM data that was collected. So those are very strong arguments for the policymakers. And then again, something that Rain has already mentioned, so I'm not going to spend much time on this because you can always come back. But what I wanted to just flag is what you need to know as a grant cycle 7 is, as we all know, 3-year funding. And then it's important that in this funding year, as maybe compared to the previous, CLM itself is actually priority for the country request. So that's a good momentum to use and include CLM in the funding request, because it's one of the indicators for community system strengthening that Rain was mentioning, and it's actually a priority. So let's use that. These are some of the submission deadlines. As we see, some of the windows have already passed, but window 2, window 3 are still here. I'm also leaving you the link that you can go back to see your specific country window. Again, this is selected only for Asian Pacific countries without going into the details, just for you to refer later back to this slide. As I already said, CLM is prioritized by the Global Fund, so let's use this. It's one of the core CSS indicators. What can we do? What can we do as a community-based organizations? We can start consultation and dialogues with the country coordination mechanisms. We can be included as a part of the writing teams. We can be ready to describe proposed CLM interventions in the funding request. We can be ready to describe the CLM costs, so prepare the budgets, because that's also always the request of the writing teams. Some of the examples of fundable CLM activities: development of the national CLM frameworks, maybe for more matured context, development of the CLM tools, technical support and training for CLM, indicator selection, data management, data analysis. This is where we usually, as an ITPC, in our hat as a technical assistance provider, come in. Key resources, again, this has already been shared, just for you to reflect after the webinar. My colleague Selvan will share more about the principles that have been adopted on the CLM principles by the kind of global community of CLM implementers. Just a big snap on the technical assistance that's available. One of the questions from my end to Michaela was technical assistance available via UNAIDS, via technical support mechanism, because I know there has been some confusion, let's say, about that one. So maybe if she can provide some clarification, or not now, maybe later. How can our or local partners actually easily access funding for CLM technical assistance via UNAIDS? On the other side, this is from the Global Fund side. What is important when you are submitting your technical assistance request is to be at least 6 months before your country selected window. So you have to go backwards. Let's say if the window is in October, as we see here, then now is the time in May to submit your technical assistance request. If you want, for example, one of the technical assistance provider to support you with CLM. And this is usually the form, how it looks like, just so you know. And you should reach out to your regional platform that can help you with assisting the TA request. As we see here for Asia Pacific, that's APCASO. You have an email here. And also already shared by Rain, our contacts from the ITPC Global side, myself and my colleagues Nadia and Krista, which we're always available to respond to your email or organize a quick call. And Keith, Rain, and Sue from the Global Fund side. So CLM resources, there is a wealth of resources of CLM in, I think, Spanish, French, Portuguese, Russian, many languages, English, of course. So please, this is also what has been already shared. CLM, ITPC has tried to gather all the up-to-date knowledge on a platform that's called CLM Hub. So please feel free to go to the www.clmhub.org and you can explore and you can see what is there, what has been developed by ITPC with support from different donors, or what has been developed by our partners and fellow TA providers. So we will all try to gather this on the CLM Hub, so that it can be also kind of like a one-stop shop for everything related to budgeting, to indicator selection, to data management, etc. Thank you very much. I'm glad this is not a translated webinar, because translators would have a very big problem in following the pace of my talking. But yeah, thank you so much. This is from my end, and we are open to questions, and I will share my email as well, so you can reach out afterwards.
Great.
Thank you.
Thanks so much, Yelena, and we're so glad that there were no issues from the internet side, because you were worried that from Malawi there might be some issues, so that was great. Thank you so much. And then I think there are some questions that would want you to answer in the chat, so please everyone, if you want to have any more clarifications or questions to Yelena, please feel free to type it in the chat box. And without further ado, as Yelena mentioned, Sullivan Anthony from AppCom will be talking about the general principles on the CLM. So Sullivan, over to you.
Thanks, Midnight. I'm looking for my slides. Vanessa, can you put on the slides, please?
Great, we can see the slides.
Thank you, Vanessa. This again, my name is Sylvan Anthony, working in AppCom as a capacity strengthening officer. Next slide, please, Vanessa. So in this session, I'm going to actually talk about the background that AppCom engaged in the CLM work. And I'm also going to talk about the general principle and importance of CLM, possible outputs from CLM, and the process for developing and implementing CLM. Next slide, please, Vanessa. Thanks. I think Midnight has already covered. Just to give you a background again, so AppCom has been engaged in the CLM work under the Global Fund grant since 2018, and been providing technical assistance support to the partner organization, the Asia and the Pacific region. Again, to highlight, in the year 21 and 22, AppCom has conducted a few capacity building webinar for CLM implementers. This current capacity building webinar is actually led by AppCom with the support received by other regional networks in Bangkok. Also, this webinar is funded by US CDC through UNAIDS RST. Thank you for that. Next slide, please. So talking about the general principle, if you look into the CLM, we have 7 general principles. These are very, very general principle again. So it might differ in different, CLM toolkit or guide. The first one I would like to say, community-led and community-owned. CLM should be community-led and community-owned. Under this intervention program, communities are the leaders for the community-led monitoring intervention, I think, which is already spoken by Elena and Francis also in the previous slide. And the second one is action and accountability. CLM also requires action and accountability focused by the key population communities. And third one is independent. CLM intervention should be independent and not directed by the government or any stakeholders at the country level. The fourth one is routine and systematic. CLM is not a one-time process. It should be routine and systematic. I think this has already been, again, shared by Elena in the previous slide. The second last one is focused and result-oriented. It should be focused and result-oriented. We should also be thinking and remembering that the ultimate goal for the CLM intervention is to improve the quality of HIV services. And the last one is open and transparent. CLM should be open and transparent throughout its implementation. It should involve the stakeholders and the communities since the beginning of the CLM work. So in summary, I would say that we have 7 general principles of CLM. Next slide, please. So importance of CLM, some of these points are already covered, in the previous slide. Again, I just want to highlight this. CLM is important. Why? Because it actually contributes to the community system strengthening. It also contributes towards service quality improvement. CLM is important because it also allows for effective partnership and engagement to act upon service quality issues. It also allows allows the communities to have a very meaningful engagement in the decision-making process. Last but not the least, I would also like to say CLM allows the key population communities for the evidence-based advocacy to bring in the desired changes. Thank you. Next slide, please. So the possible outputs, this is very, very possible, I would say, but it could also differ from context to context. The first one, I would say, this is establishment of CLM mechanism. Through the CLM intervention program, the key population communities can actually establish the community-led and feedback mechanism at the country level. The second one, what we can expect is availability of community level information. The CLM intervention program allows for the community level information about the availability, accessibility, affordability, and the quality of HIV services for the key population communities. Last but not the least, set of recommendation. The CLM intervention program also provides a set of recommendation to the key population communities to improving the quality of HIV services. So these could be the possible outputs for CLM. Next slide, please. So general principle for developing CLM. Can you go to the next slide? Okay, there are 3 general principles, I would say: establishing a technical working group or multi-stakeholder committee, drafting and finalization of data collection tool, and the final one is final approval and consent from the government and other stakeholders. Can you go to the next slide? So talking about establishing a technical working group or multi-stakeholder committee, this is very, very important during the initial stage. A multi-stakeholder committee includes the critical and important stakeholders, which are essential to ensure that the HIV services at the country level are delivered as per the country needs. These stakeholders may include important government officials from the national HIV programs, etc., or CCM members as well. The multi-stakeholder committee will guide throughout the implementation of CLM. So the first one, I would say, the establishing a technical working group is very, very important at the initial stage. Next one, please. Drafting and finalization of data collection tool. So again, this is one of the very important aspects in the CLM development. When developing the tool, it is important to look into the different aspects, which Francis already mentioned, I would say. The AAAQ, one is availability, accessibility, affordability, and quality of HIV service. So once the tool is developed, it is also good to seek recommendation from the potential stakeholders, technical committee, and the committee members and others. Once you collect the feedback from them, please incorporate it and finalize the tool. That is, again, a very much important one. So once the tool is finalized, please also ensure that you do the pilot testing, to check the time taken to complete the tool, the flow of questionnaires, appropriateness of language, and etc. Once you collect the feedback after the pilot testing, so include that in the CLM tool and finalize it. Next one, please. And the last one is, final approval and consent from the government and other stakeholders. Once the tool is finalized, internally after the pilot testing, please ensure that you also seek approval from the government and other stakeholders who is involved or who is going to actually help you, implementing the CLM in the later stage. So these are three general process for developing the CLM. So next slide. So again, now I'm going to talk about the general process for implementing CLM. There are actually 7 steps to be followed for CLM implementation. Next one. The first one is the planning and developing the operational plan. It is highly recommended that you develop this plan at the initial stage, which can include activities such as recruitment and training of data collectors, timeline for data collection, etc. It's just a work plan. It is also advised to involve all the team members who are actually involved in the planning process. Through this process, the team members have a very detailed discussion and the processes, and a detailed operation plan could be developed. That's number one. Number two is the recruitment of data collection team members. So once you have the operation plan, it is advisable that you recruit the data collection team members. But here, the program managers can actually determine the selection criteria for the data collection team members. Then, depending upon the available resources and the sample size, the organization can recruit the data collection team members. That's number two. Next slide, please. The third one is training of data collection team. After the recruitment of the data collection team members, a training of these teams should be planned through in a very detailed and thorough manner. While conducting the training for the data collection team, it is also advisable that you involve the stakeholders and the technical committee members, which you already formed. That is important to ensure that the data collectors are well trained. And the fourth one is the site preparation and site management. Under this process, it is good to inform the facility centers about your CLM intervention program. It is important that the facility centers at the site understands the details of the project and the importance of working together. So in this process, the CLM project team needs to introduce themselves at the facility centers before they start gathering the data or start doing the interview of the respondents. Next slide, please. The fifth one is recruitment of respondents. In this stage, the data collectors can start recruiting the respondents. And the sixth one is analyze the data and development report. Once the data is being collected, then analyze the data. Data should be analyzed in such a way that it should be or could be easily explained to the stakeholders and the community. After the data is being analyzed, please develop a report and disseminate the findings. It can be done through meetings with the stakeholders and the community members, or else you can do a short brief, or else you can put it on the newsletter, etc., etc. So the last one is advocacy for desired changes. Once the CLM is shared or disseminated, please conduct a follow-up meeting with the stakeholders for bringing desired changes. You can also ask your technical committee team members to help you conduct advocacy, with the stakeholders. Ensure that when you are having this meeting, you have a very meaningful engagement with the stakeholders to make the CLM sustainable at the country level. So in summary, I would say there are 7 steps for implementing the CLM. One is planning and developing the operation plan, recruitment of data collection team, training of data collection team, site preparation and management, respondents, recruitment of respondents, analyze the data, develop the data report and disseminate it, and advocacy for desired changes. Next. So yeah, these are some of the general principles for developing and implementing the CLM. So if you have any questions, please feel free to write to me or else contact us. We are very happy to support. Thank you. Over to you, Midnight.
Thank you so much, Salvan. Yeah, for that very quick lightning presentation. And you please send your emails into the chat box as well, so for people to contact you directly. Oh, well, everyone, so that's like seems very general discussion and presentations. I do apologize, we won't have time to do the Q&A, but please do send your questions into the chat box, and the speakers, please do watch out for any questions that you can answer, then please answer them in the chat box as well. For the next one, I'd like for us to then look to some country-specific examples in our region from Southeast Asia and also from South Asia, looking at like what is the most recent and relevant CLM models and tools that they've used in our region. Maybe would like to start with, oh, yeah, she already came on, so I'll go. Let's go to India from so Yasminder Singh from the Pahal Foundation, India, to talk about the CLM tools and models that they've used.
Thank you, Midnight, and hello everyone. It's my pleasure to be here and talk about CLM. And I've been part of the entire journey throughout. I mean, I remember we started somewhere in 2019, 2020. And then, of course, COVID came, there were some delays, but we are very much on track. So should I share the PPT here?
Yes,
Selvan?
please.
Oh, yeah, okay. Okay, so it's here. Yeah. So can we go to the next slide? Yeah. Perfect, thank you. So what I'm going to talk about is the CLM and basically about the community system strengthening, which is a larger perspective when we talk about, communities leadership and engaging the communities into the system so that where communities take the ownership and they lead the entire process. And I think India has set an example out here if we talk about, and thanks to our leadership also, being it at NACO and government, which has supported us in this whole process. So this is a colorful picture which basically talks about that, community system strengthening, how it's very important. So you know that India is a large country with a lot of, geographical changes are there, socio-cultural differences are there. So to understand this diversity, our national government has come up with the plan and which is about CSS. And under this main idea is to kind of, collectivize the community, mobilize them, then building their capacities, further, engaging them into the desired advocacy, so that we can go for demand generation, because that is one very important part of the entire structure when we say CSS versus CLM. Now the CLM is a very specific part we're coming to, where we talk about the supply side things, where we focus on managing that, how the supplies are there, whether commodities are there, whether the entire CLM, where the community-led monitoring is happening. So that is the beauty of this model. And ideas, specific objectives are support and enabling environment for the communities, demand generation and increased testing and prevention services, care and support for those who are involved into ART, and also not only health but beyond health services like social protection, treatment adherence and literacy, and also ensuring that community is the key who are engaged into the monitoring and effective and quality program service delivery. To next slide. Yeah, so these are the core components we have covered. It first is mobilization on health issues and on the social issues. This has been happening. Then establishing linkages with various service facilities, whether it's health or beyond health facilities. Then collaboration with all the National AIDS Control Program services, which is a focus for CLM, and coordination with public health and other components which are important for the communities for creating an enabling environment. Next slide, please. And in this whole process, we started with community engagement, and then we went on to capacity building of the community and gathering the evidences, which is for implementation from the field, and generate solutions. So if there are some issues, and generating a solution and engage with the state and go into the implementation and effective M&E of the program. Next slide, please. So capacity building was one of the key things, and India is a big country. We have around 600 districts are sub-national level areas, and first and foremost, we have done the needs assessment with the various communities, with key populations, whether it's FSW, IDUs, transgender, and MSM, and then we identified the community champions. These are the community people, the community resources who are going to kind of implement the CSS and CLM at the national level and sub-national level. So once this need assessment was done, then a set of modules was developed, and it was again, kind of whatever the needs, because we know that post-COVID needs have also changed. So those things were, taken into account and the modules were developed. And now the training cascade is rolled on for the community champions. So far, around 18 workshops have been conducted and approximately 550 community champions have been trained in the program. Next slide, please. This is the whole, framework which we talk about. When the input, what we did is, we invested into the capacities of the communities, which led to output increased capacity of the, community groups and individuals, and a pool of resources, which we have developed at the national and subnational level. Second is input for establishing the CLM system, where, which will help in strengthening the community monitoring, and an outcome is capacity of the community organizations and communities are built up and they're taking part in the HIV and AIDS response. Also improvement in HIV comprehensive service delivery, because that is how we are going to help in terms of, ensuring the services for prevention, treatment, care and support available to all the communities. Next slide. What we did at the national level, under the leadership, we formed the national working group. Then there are state level, which is a sub-national level. We formed the state community resource group. Then there is the district level, which is a sub level, where we form the district resource group. And community-based organization capacity building is the key here. Then community championship initiative, which I'll talk in next slide, strengthen the community network and engagement. So all this will lead to a comprehensive community-led monitoring system. Yes, next. So at the national working group, which was constituted in May 2021, and there were 24 community leaders who are very much, part of the system. And the whole idea of this group is to kind of, oversee the CSS and CLM in the country and provide their inputs into, the whole process. Next slide, please. Then there is a community resource group, which is at the sub-district level, and their idea is to kind of, identify the people and understand and resolve the issues, whatever coming to them. It is a state level body, and in each state level we have community resource group, which has equal representation of all the key populations here. Next, I'm just pushing it a bit because we are running out of time. Yeah, next slide, please. I'll share the PPT with you. Can you go a slide back? So that is the initiative. These are the people, and approximately 7,000 plus people are going to be here. They are from the communities who are going to do the CLM part and going to help in the community system strengthening. Next. So far what we have done, we have covered already this part, and we can go to the next slide where, yes, next slide, please. So 6 modules have been developed, and the capacities are built on the community on these, points. I'm not going to read it, but these are the 6 manuals which are being developed jointly. Next, please. So this is a community scorecard, where we are going to focus on the services part, where we talk about the targeted intervention, the DIC, HIV testing, STI treatment, linkage to the other services delivery points. Then there is commodities, which is production, whether condoms are there, needles are there, OSTs there, drugs are there. Then aspects, whether the acceptability, accessibility, affordability, appropriateness, availability, accountability, responsiveness, and the utilization of the things is happening. So far, pilot have been done in the states like Telangana, Maharashtra, Delhi, UP, Manipur, and Nagaland. And the tools are going to be very interesting, because India is a country where a lot of population may be the literacy is a challenge, the internet availability is a challenge. So government has actually our leadership taken into account, and we have come with 2 types of modules. One is with online, and second and with the offline modules, tools. And here also a lot of formulation and combination we are trying to see how we can better engage the communities and those who are going to respond to the CLM when the thing will hit the system. So this is in brief. I know there was a shortage of time, but I tried to be in time. But yeah, if you have any question, please feel free to kind of ask, and I'll respond to you. Next, please. And I think with this, we're going to end. Thank you.
Thank you. Thanks so much, Yasvinder. And also to see the scorecard being implemented in different states, also in India as well. From like a big country, let's go to a smaller, hopefully more manageable country. Let's go to Cambodia. I would like to invite Samsopal, who is a program manager of the Cambodian People in HIV Network, to talk about the experience of CLM in Cambodia. Samsopal, nice to meet you. Nice to see you. The floor is yours.
Yes, thank you very much, Midnight. Due to my internet is unstable, a bit unstable, so I just turn off my camera. Okay.
Yep, that's fine. Thank you
Yeah,
so much.
thank you. Yeah. Actually, in Cambodia, CLM, we already
Oh, we can't hear you, Sopal. Sopal, we cannot hear you. I think Sopal just dropped off. Just check.
hello.
Oh, hello, you're back.
I'm so sorry.
No, it's okay. I think you can talk, and then I think our team can still do the PowerPoint, right? Can you still see the PowerPoint?
Yeah, yes, yeah.
Okay, great.
So just next slide, please. Yeah. Okay, and yes, next please. Yeah. Okay. Just introduce a little bit. In Cambodia, we start CLM with our fund palm and the fund palm since 2021. Yeah. And up to now, we our process come into the some result, yeah, that we produce, and we also share into the community. Please go to the next slide. Okay. Yeah, like we say just now, we start in Cambodia since 2020 during the COVID outbreak. But after that, we try to just have a sub meeting and also preparation until to the mid 2022. We are lucky enough we can produce some result, yeah, and go until the 2022. Yes, next please. Did you hear me, Midnight?
Yes, we can hear you. Continue.
I'm afraid I speak alone because of the internet. Yeah. Yes, the same as other country in Cambodia. CLM, we after we combine the group of fund palm and different palm, we planning, we do data collect information, and also community scorecard, and also have some training support from the different.
So Paul, we're losing you. We couldn't hear you.
I so sorry.
Okay, so you're back. Can we go to the next slide?
Yeah, please. Yeah. Next slide, please. Yes. Okay. This is the second revision. Yeah. So due to the internet is very bad, I cannot explain more. But I just said that this is the second revision or second result that we produce and put into the practice and to the community, and also produce some result that we have prevention, we have PrEP, we have sexual transmitted or STI or can treatment, social protection scheme, GBV, stigma and discrimination. All these tools we share by link to each group of our team, of our member. like from PLHIV, we share to the KP member or network. So after that, we
Oh, and then we can't hear you again, Sopal. Can we go to the next slide? Sopal. And can I see the next slide?
midnight.
Oh, you're back.
I'm sorry, due to the internet is unstable. Could I wrap up just about 2 or 3 points?
Sure, you can wrap up. Thank you.
Yeah. Actually, in Cambodia, after we set up the CLM, right now we already put into practice, and we also produce the 3 more results or paperwork that we call CLM operational guideline, CLM roadmap, and CLM community engagement strategic plan. And all these 3 paper or 3 policy we already
Oh, we're losing him again. So the result you can see here already on the slide. Can we go next slide?
launching, and also start up from the National Aid Authority on this CLM. Funding request from the Global Fund from 2024 to 2026. And this is the result that we can say that in Cambodia, after we do the second revision, we have paperwork, and we also have put into the funding request. Yeah. So can you get my wrap up, midnight?
Just a little bit, Sopal. I do apologize because of the internet access. I think what would be good is for us to also do a recording with you and the PowerPoint, and then we can then resend it to the other participants as well. Because I think what Cambodia has done is the community involvement, but also to redo the tools and reusing that for your next Global Fund request as well. So I think that would be very useful for participants for today. Thank you so much, Sopal, for sharing us the experience from Cambodia. And I apologize for everyone else for the internet issues, but we hope we'll be able to send you the recording from Cambodia as well. Okay. Right, now I want us to maybe have a bit of time to also have our own discussion within the people who are joining us this afternoon. I'll pass over to Salvan to let us know about this group exercise, about engagement on CLM within our region. Salvan.
Thanks, Midnight. Yes, of course. We are going to have a group exercise on breakout rooms. So in the breakout rooms, we are actually going to talk about the engagement on CLM work, vision, and the opportunities for TA. So each group members can discuss with the facilitator. So each group will have a facilitator from the regional networks. The facilitators are Francis from NAPOD, Harry from APN+, Ika from Youth Lead, Joe from APTN, and Katie from APNSW, and Sita from ICWAP, and Ingrid from UNAIDS. So these are the people who is going to lead the breakout rooms, and we'll be having some questions to discuss with the people whoever is in the group. So you will be now divided into the groups or breakout rooms. So this discussion is for 20 minutes, and after 20 minutes, you can come back to the main room for reporting back. The facilitator can, report back, or else facilitator can assign somebody from that group to report back. It's up to the facilitator. So see you later after 20 minutes. Thank you.
volunteer to present the report back later on? Tamai, Swesono, Rahat.
Hello, my name is Rahat, but I'm not representing CSO. I'm representing USAID, so I'm not sure
Okay.
that
Okay.
I can.
All
Sorry.
right. All right. So Sway in Tamil, Tamai. All right, let's start. Let's start. So we have 3 questions that we need to address. So the first one is, what are the ongoing challenges and gaps that affect CLM implementation? Any thought from that?
Hello, could you
Yes.
please type the question to the message bar?
Okay, just a moment.
Thank you.
There you go. That's the question. So anyone can answer about this. The first one is, what are the ongoing challenges and gaps that affect CLM implementation? So we only have 20 minutes. So we have 3 questions that need to be addressed. So there's 5 minutes from each question. So anyone, please raise your hand. Swesano? Otamai? Asam?
Hello, hello everyone.
Yes.
Yeah, I just wanted to share, we have not actually started like full-scale CLM in Kazakhstan yet, but we are now starting it. We have conducted one pilot cycle in one of our sites, and one of the biggest challenges was the absence of actual like interest from the stakeholders to participate in this, especially from primary healthcare facilities. They didn't show any willingness to engage and to work on this, and also community representatives, the clients, they also didn't show much interest. So that was, I would say, the main challenges that we faced.
Okay, so we heard from Kazakhstan. So from Asia, Tami, Sway, please say something. Hello. Zuzu, maybe you want to say something. What is
Okay.
challenges we're facing in Myanmar?
Yes, now we are implementing CLM process, like a pilot process. Actually, now we implement only 2 cycles. At first, we plan to implement quarterly cycle for a year, but because of our country situation, we can implement as we plan. So the implementation plan changed into biannual, like 2 years. But we were trying to implement quarterly for the next year. So in this process, the main challenges is we cannot do the CLM implementation at the national level public sector. Like we can only implement at the private sector, like global fund vendor service provider side and also PAFA vendor service provider side. So now PGK is like a donor means PAFA vendors service provider side. We implement at the side, and then we also collaborate with the MPG, Myanmar Positive Group at our Myanmar. So they are implementing at the global fund vendor side.
Okay.
Yeah. This is the main challenges is this is the first time in our country the CLM process. So the community is not the community is not also familiar with this process. Actually, in Myanmar, we already have and it is actually implemented by the MPG. We already have the CFM process, community feedback mechanism. This mechanism is like the how I can say like we can know when the issue is outcome to the national level or something like this. We can only know when the issue is come out. For the CLM, we can also know like the active monitoring to the service provider side. So this is the difference between CFN and CLM. But actually in this process, the community is not clear for that two process. So we are now trying to understand, to aware the community more, and also for the service provider side.
Okay.
Yes.
Okay,
and,
thank you, Zuzu. Anything else?
And I have one more thing to point out is about the strategies. So we are planning like the quarterly for the two. Our two is like the paper-based tool. So we also have qualitative question for CLM process. So this may have we have the how can I say data collection teams. So the data collection teams we recruit from the CFM side for the data collection team. If at the stage the data collection team not permanent for that data collection, because we are planned. Actually, we are planned for quarterly. We can only do biannually. So the time cap made them to remember the question is or something like this related to the CLM. They focus everything during that timeline, and sometimes and some places already trained to CLM data collector. They resign for the next cycle. So we have to recruit new data collection team for the next round. So we have to do data collection the training for capacity building training for data collector team for the next time, and also train for the how to advocate with the service provider side, how to collect the data side. We have to do the next time like this. So we how can I so we spend more we need more time to train them and to implement the cycle next round.
Okay, so let's hear from Rahat. Please go ahead.
Yes, thanks so much. Very quickly, so our country implements CLM project, and we were piloting within for a few years CLM. We had some pilot stages, and currently we plan to expand it. And some challenges that our CLM implementers is facing, and it's reported in different reports and in different stakeholder meetings, includes that not all community organizations understand CLM as a monitoring tool, and some of them perceive that it's an audit, or it's some controlling exercises over the work that is done at a facility or the community level, and therefore some of them they are reluctant to speak openly about the challenges and issues that they are facing during the service delivery, or which are faced by different clients, different beneficiaries. In general, I would like to mention that according to my observation, that no many civil society organizations that fully understand the goal and the main purpose of the CLM. That definitely CLM is not only data collection. Data collection is just 50% of the goal of the CLM. It's also a forum for the solution, because CLM not only collect information about the situation and challenges and in general providing a picture about HIV services provided in different sites and facilities, but it also provides us opportunity to talk about with different stakeholders and to find solution and implement this solution. And unfortunately, this kind of, I think, completely skipped part. And we also should understand that we should try to promote like these health champions and provide health literacy support within CLM. It's not data collection only. Thank you.
Yes, thank you so much for sharing that one. So let's move for the second question. So what you guys think about the strategies to sustain the CLM? You know, we heard from the presentation today that you know, ideally the CLM data could be incorporated to the information systems at the national level. But is there any other strategy that to make sure this is CLM is sustained in your countries? Maybe please share. Suzu, Sway, Rahat, anyone?
Can I start?
Yes,
I think in my opinion, I think that CLM approach should be the same in the country. So if different actors who implement HIV program and implement CLM, they use different tools, different approaches, this will never provide opportunity to have some like sustainable CLM approach. I think that all tools, all CLM approaches should be aligned with according to some common guidelines that might be used by different agencies in the field. And this is a very basic and baby step that we should start from. Thank you.
Yeah, I think there was a discussion on that was coming across during the CLM global meeting was held in Bangkok last year. Yeah, so next, Suzu, if you have to share something, you know, how do you think that, you know, to make a strategy to make the sustainability of the CLM? Maybe Jelena, you can also add it from other experience in the country, in Africa, Malawi, about the sustainability of the CLM.
Yeah.
Suzu first. Yeah, Suzu.
Yeah, okay. As I say, actually our country is not our country is in the political issue, so we can implement at the national side. So for after that pilot side, actually we are implemented at the pilot side to the service provider side. So while after the pilot side, we have to advocate to the national side, because this is also have to know to the national government, so we can change the policy issue. So we haven't go to that side. So just only to the service provider, private service provider side, we have to do this side for the next step. For the private sector side, we have to do more about the we have to learn from the other country CLM implementation, because we are just implementing from the technical assist from the ITPC, and some we are using the questionnaire from the like ITPC technical assist. So this we have to change to the our country niches, and we have to learn more about from the experience from the other country. And then like this, because we have to go to the next step. We just implement it at the private sector side.
Okay. Jelena, maybe you can share a little bit what, you know, how in Malawi they try to maintain the sustainability of the CLM.
Yeah, the thing is, it is still kind of this dual nature of CLM, that we want CLM to be independent, but then on the other side, it is still funded by the donors, right? As we can see across the board, even in countries like, for example, we work around the world, and we see the differences in contexts like in Jamaica, where there is government fully on board with CLM, and there is a national CLM strategy developed. There is community treatment observatories, very functional. There is this mystery shopper kind of triangulation of the CLM efforts, but still there is a question of the future of CLM, the sustainability in terms of, we know that data collectors should not work for free, right? That they need to be paid, and how to, that is still a question, I have to say, across different contexts, how to make sure that what is the future of CLM? Do we come to the point that even the government leaves the independence of the community, but supports the community to support them? You know, that is some of the question that we are also trying to think about. And at the moment, it is very donor supported. And as long as there's a clear, clear guidelines and clear the division of roles, we have to avoid conflict of interest.
Okay, thank you, Jelena. I think that's a really excellent statement from you. And it is the most challenging things that we face regarding to CLM. So we come up to the last one, since we only have 2 minutes left. So from both strategy and identify, what support you needed from the regional network? Maybe Suzu first, and Tamai, Sano from MPG, please share something if you know.
Yeah.
Yes, go ahead.
So I think our community can stand themselves because we just only stopped during 2021 for the CLM implementation, and we start implementation during 2022, and we keep going for the implementation. So the community still need to aware what is CLM and how they can do themselves for keep going to the CLM. So they still need the funding support and also technical support, and they also need the experience from learning experience from other countries. I think so.
Okay. Anyone else? So if not, I think we have to go back to the main room. So just wait. So anyone else? Maybe Tamai and Sano, do you want to say some things? Jelena, last word.
I would say that it's important to keep the dialogue between the regions, between the CBOs, between the donors, between technical assistance providers. It's hard when we are like so involved in our daily lives, but to keep even this type of webinars, it's amazing that we have a dialogue, that we communicate, that we share information. So that's critical, so we don't feel isolated and working in silos. So it's good to always communicate when we can.
All right. So thank you, Jelena, for the last word. So I think we have to go back now. So I'm gonna leave the room, so everybody can leave breakout room now. Thank you.
Hi, everyone. We're just waiting for others to rejoin the main group. Apologies, I know it's not enough time. It's not enough time when we do breakouts. Hi, everyone. I think we have everyone back into the main room, and I do apologize that there's not enough time for you all to discuss a lot of issues, challenges, and experiences on your country. And we already taking a lot of your time already for this afternoon. This webinar is like 3 hours, but don't worry, there's going to be more series of other webinars as well for you to be able to share your experiences. So in the breakouts, we have altogether 6 groups. I'm wondering if, who'd like to go first in terms of report back? I'll maybe start off group 1. Who is in group 1?
So, hi, Midnight, the group 1.
Hi.
Francis, Michaela, V, and one's from Pakistan and one's from Asia. So, maybe we just want to report regarding to our time is only limited, it is just limited. So we just make some little bit note about the feedback and the situation from the exercise. So
Right. Thanks,
for
Davi. Can you
Oh,
put your camera on?
okay, sorry.
Thank you. Yeah, so we can, yeah. So everyone from the on the web can see you as well. Great.
So yeah, this only a little bit a note from our discussions on the group. So maybe later Francis or Kela can add some more topic regarding to the what we had discussed earlier. So the first one, we only have one active participant that is from Pakistan. So they said they are already have a good training regarding to the CLM from UNAIDS in Pakistan, and the stigma and discrimination are still happens in Pakistan, and also the lack of involvement of and the support of sex worker organizations in Pakistan also still, yeah, the support also still limited, and the community in Pakistan are still thinking for like they think that for what we are working in the organization, or for what we are working as an outreach organization, as an outreach worker, because the way they can earn the big money is only through a sex worker, like through a sex working, something like that. And then the last one is there is still happen the exchange of drugs with the sex services. So yeah, maybe that's it. So Francis and Kayla have more information, so please go ahead.
Thanks, Davi, for reporting back. Francis and Michaela, anything to add to what Davi said?
Nothing to add from my side. Thank you to Davi for the excellent summary.
Excellent. Thank you. Francis?
Thanks, Davi, for summarizing this. Thank you so much.
All right. Okay, let's go on to the second group then. Harry?
So it will be me. So the second group is mostly from USAID, Helena, and also two from Myanmar, and I don't know where the other guys coming from. But anyway, so the first question is what ongoing challenges and gap. Basically, we identify there's 3 gaps that happening from the participants, which is according to country in the ECA region, there is a absence of connection between healthcare facilities in terms of accepting the CLM processes, and then in Myanmar, due to the country situation right now, there is no national level CLM implementation, especially on the currently only for the public facility that provided support by Global Fund. There's also confusion on terms of the community feedback mechanism versus CLM, because there's so many countries in the community in the Myanmar, they still cannot be distinguished the differences between CFM and CLM. And then also not all the from Kyrgyzstan, there's not all community organization understand CLM as the monitorings, including the goal. That's why because of that, many of community are not really involved into the CLM processes there. In terms of sustainability, there is also should be the same tool across the countries in order to make sure that the CLM is really implemented properly, and then also yeah, so there is no yeah, that's it for regional support. What they need is to expand the community communication among countries by cross-learning to make the dialogue between countries more lively, more continuously, and so we are not, always going into silos. Maybe for other members of Group 2 would like to add something. All right, so Metan, go ahead.
Oh, sorry, did someone want to add from the group 2 to what Harry mentioned?
No, I just said thank Harry for summarizing.
Yeah. Okay, great. All right, then I'll just move on to group 3 then, who's been assigned for group 3.
Ours was group 3, right? Ika?
Ika, yeah, so it's Ika's team, yeah.
Yes. Hi, Minat.
Hi.
This is Sanjeev. Good to see you after a long
Sanjeev,
time.
good to see you again. Have you been assigned?
Good to see many familiar faces. So, yeah, I'm reporting back from group 3. So it was Avina and Saukat from India in my group, and AA from Myanmar, Umesh and myself from Nepal, and Ika was our facilitator. So the first question we discussed was, what are the gaps and challenges in implementation of CLM in our country? The first challenge that we identified was the community champions or the community volunteers or the CLM officers, whatever we name it, they are currently being paid very less, or in some countries, they even work as volunteers. So they should be paid adequately for good implementation of CLM. That was the first gap and challenge. And another challenge that we identified was the increasing the ownership of CLM activities by the state or the province level government in different countries where it's being implemented. So currently it's either donor-led or NGO-led with very much less ownership from the state or the province. So increasing the ownership from the government is another challenge. And another challenge that we identified is the sustainability of CLM. As we know, most of the countries in Asia Pacific are also now transitioning to upper income or upper middle income countries, and Global Fund is soon pulling out from some of the countries. So the major challenge is what will happen to the CLM that's currently being implemented with the funding from Global Fund. So sustainability is another challenge. A colleague from Myanmar mentioned due to the political situation or political turmoil, it's very difficult to implement sometimes CLM activities. So difficult political situation is another challenge. And another challenge we discussed is the standardization of data collection tools. Currently, different countries are using their own version of data collection tools. So it would be good to have a standardized, it could be tailored to the country specific need, but it could be good to have some standardized tools that could be tailored to the country needs. So those were the challenges that we discussed. Regarding the strategy that could be implemented to sustain CLM was another second topic that we discussed. So the main strategy for increasing the sustainability on CLM is advocating for increasing the domestic financing, or advocating for increasing domestic health resources for implementation of CLM. So that's the main strategy. And another strategy is training as many community champions or community mobilizers or community volunteers as possible, so that they could, in the future, they could be implemented with very minimum resources. And advocating with other donors besides Global Fund and PEPFAR as well to invest in CLM is also another strategy for sustaining the sustainability of CLM. And regarding the support that countries need from the regional networks, we have basically identified 3 areas where the supports are needed from the regional networks. First is, as we already discussed, advocating for sustainability of CLM in activities. Of course, the countries need support from the regional networks for advocating for sustainability of CLM. And another challenge or gap in current implementation of CLM is most of the countries are focusing on only on implementation of CLM with very less focus on advocacy part, because as we know from the previous cycle that Selvan presented, advocacy is also one of the main important component of whole CLM. But most of the countries are focusing only on implementation with very less focus on advocacy. So the area where regional networks could support is providing technical assistance to countries on how they could use the data gathered from CLM and advocate for increasing the quality of services. Yeah, those were the points that we discussed. Thank you.
Wow, that's so comprehensive. Anything to add, Ika? from your team?
Nothing to add from it.
Okay, excellent. I think we didn't have a group 4, so who's in group 5?
Okay, I will present for group 5. So most of our the team in the group 5 are all from the same organization, and are all from Nepal. So ours will be very, very brief. So in terms of the ongoing challenges and gaps, these are projects being paused or stopped entirely because of funding issues, and this caused some disruption in the momentum, and also like plan dates for things to actually happen for advocacy purpose. And there is no emergency funding that came out for issues during the monitoring process. So it leaves people hanging there knowing what the problem is, but couldn't timely address it. In terms of strategies to sustain CLM, Nepal government has been very supportive of a lot of initiative, especially on HIV issues. So there are quite a bit of support financially from the government. What has worked very well for them so far is that the government buy-in is very strong politically. And in terms of TAs from networks and partners who have expertise in CLM, it's how to use this data, just like what other groups have already mentioned. So how to use this data for advocacy and conflict of interest piece. Should the one monitoring this data also be the one providing services that are being monitored by themselves? And then to be aware of training and knowledge of new tools that have emerged, success monitoring that people have done, and trainings on how to use these different tools. And one more thing is data security. So there's still these issues about how to protect this data that they hold and the ownership of this data. Delvin, do you have anything else to add, or anyone from the group?
I think it's all good. Thank you.
Okay. Thanks so much, Joe. And great to see. Great to see. Like you have time to do a PowerPoint presentation on that as well. That's brilliant. And then group 6, I know Sita was not able to continue to join us, but I think Dennis is gonna. Daniel, is it going to?
Daniel,
yeah.
I'm
Brilliant.
representing on group 6. Yeah.
Brilliant. Thanks so much, Daniel.
So on the ongoing challenges and gaps that affect CLM, first thing would be logistics. So basically about the last mile reaching of the efforts, as well as committed budgeting for CLM. This is because to ensure that people are adequately paid for their time and commitment, and to have people, stakeholders, to have a sense of responsibility in the CLM as well. Second would be in terms of data where there might be an overlap of tools and methodology used. And then when you have too many data that's being collected, like which ones are more relevant to the ones that are being discussed, or which ones do we isolate when there's such a large pool of data that we have collected from participants. And then last would be stakeholders. So how do we work with government or healthcare organizations to ensure that they are open to working with a CLM model such that we are able to cooperate with them rather than seeing them in a competitive manner? In terms of strategies to sustain the CLM would be capacity building on sustainability for tools. This involves training as many people as you can so that you reduce the risk of people leaving or people quitting and then having to redo the whole training cycle over again. And the second would be to find as much domestic funding as possible. So this makes sure that there's a constant pool of finances over a long period of time to make sure that the CLM is at least financially sustainable over the next few years. On the last topic about support from regional networks and international networks, I think one of the key things would be exposure. So this would mean cross-organization experience. So basically people forming core groups or individuals representing different organizations, having the opportunity to go out and explore under different circumstances, the different models that work for different organizations. So that is one key thing in terms of support that we need from the regional network. Thank you.
Thanks so much, Daniel. Anyone else from group 6 who want to add to what Daniel mentioned? I think I'm hearing a lot of the repetition as well in terms of the needs and the gaps. All right, then let's go to the last group, group number 7. Who is going to report back?
I will.
Oh, was it Ingrid? Thank you.
Yes. And also to avoid being too repetitive, I will mention some of the points that we were discussing. Our group had representatives from Vietnam, from Philippines, from India, and from Indonesia. So the ongoing challenges and gaps clustered it into 4 main challenges. The first one is capacity. Some are maybe still unfamiliar with CLM and actually joined this webinar to be more familiar with it, to learn more about it. And so capacity building and creating that understanding among community-led organizations is really, really important, an important challenge to address. However, there's also recognition that capacity building requires a lot of funds, and that stems into the next challenge, which is about sustainability and continuous funding for CLM. The next challenge that was mentioned was the multiple CLM models that exist, including in one country. Some ways to handle that is to work together as a task force, but there's also some recommendations to have, a lot of these guidelines and models be better harmonized, which is exactly what was presented earlier as well. And then a challenge that was mentioned also by the other groups is advocacy. Of course, unfortunately, there's still sometimes low willingness and hesitancy from health facilities or other duty bearers to incorporate the findings into the work. Moving on to the second question, what are the strategies? I already mentioned it a little bit, but working as a task force is a really good strategy, not only to be able to lift up the CLOs that maybe are maybe smaller in size or younger in terms of the maturity of the organization itself, but also working in a task force is a good as a task force is a good strategy to get more funding and a bigger voice overall. There's also a proposed strategy to explore social contracting and also working with private sectors. And lastly, similar to the other groups, what support they need from the regional networks is to gather all these guidelines and help us harmonize on CLM and really be able to bring lessons learned from one country to another. If anyone wants to add anything, go ahead. Thank you.
Thanks, Ingrid. Anyone else from group 7? Oh, okay. Well, we're gathering all the recommendations, and you'll get a report from that, including all the PowerPoint presentations as well. Thank you so much, everyone, for your active engagement during the discussions and also the report back. We'll have one more presentation from Dominic Kemps, who's going to go through the CLM progression matrix from UNAIDS. Dom, I know you're traveling, so thank you for joining us and be able to present maybe 5 minutes on the matrix.
Sure. No, very happy to.
Brilliant, thanks.
So you have my slides, yeah? Great. So it's great to be with you today, and I'm really sorry that I'm calling from the baggage hall at Heathrow Airport. I've just got off a long-haul flight, but I'm really pleased that my flight was on time so I can join you. And what I'm going to do very quickly, because I know I'm the last session before you and a long day, is just take you very quickly through kind of the philosophy and some of the detail behind the progression matrix. And the reason, if you go to the next slide, the reason why we developed the progression matrix was really we realized we were having these black and white conversations about this is CLM, this is not. And we realized that actually CLM is not being implemented in a vacuum, that there are existing methodologies that have been implemented for a long time in many cases that we're adapting and calling now CLM. In some cases, there are new programs that are getting off the ground, or we've got CBM programs, so community-based monitoring programs that we're trying to transition. And so the progression matrix was a methodology we developed just after observing what the conversations and firefighting issues and hearing back from people to say, listen, if there are certain elements of the CLM implementation which aren't quite aligned to the principles that UNAIDS has established or set out in the guidance, that's fine. What's really important is the progression of travel. And so we're trying to move to a system of continuous learning and strategic reflection and planning around CLM. And we hope that if implementers can use that type of approach, then we will see kind of continuously improving CLM programs over time. And I think also it's really important because it means having honest conversations at a country level. We know that sometimes these can be different because even the partners working on the ground or the donors and the partners can have slightly different points of view. So if we go to the next slide, please. Okay, so the matrix, which will be on the next slide, basically has like 7 different variables, looking at things like engagement of communities, you know, are they leading the work, geography, sustainability, etc. And the bit that here I've highlighted are the kind of the phases of the matrix. So there are things when you go through this reflective process that you might realize, well, actually, we're not on the matrix. And again, that should prompt a conversation, not cause dismay. And so what we've set up though is that there are 5 other phases here, kind of this basic or pilot implementation of CLM, kind of a more refinement and insights driven CLM. And what we mean by there is that you might not have a fully comprehensive program, but you're starting to gain some learnings from your CLM. Then we've got a systemization, so you kind of got the nuts and bolts of CLM down, and you're starting to make that systematically kind of implemented across several regions probably. And then we've got the consolidation phase. And here I think we've seen in a few countries, particularly in Africa, where there are multiple CLM programs being implemented. Often these are donor-led, right? Some which are funded through PEPFAR, some funded through Global Fund. And we're trying to see, well, can we develop one CLM approach despite the multiple donors supporting this, and kind of consolidating how we implement and also how we pull out learnings and then advocate for the change that's needed to improve services and obviously health outcomes for people living with HIV in key populations. And then finally is this institutionalization stage, which I don't think anybody's at right now. And I think it's also one of the stages that people get confused the most about, because we're not talking about here incorporating CLM data into GAM or anything. We are talking about parallel systems here, but we do, you know, because we're saying that CLM has this kind of accountability or performance monitoring type role, and so can't just be fully incorporated by the government. But we are seeing, and we've seen, I had conversations just a couple of weeks ago with colleagues, I think in the Philippines, about some of the great work happening in Quezon City there in terms of how CLM data is being incorporated into quarterly meetings, you know, in terms of performance standards, which is great, right? That's exactly where we want to get to. And hopefully we can also get to a point where government is also one of the donors, that even if there might be some critique along with it, government is one of the donors, you know, to support CLM along the way. So the matrix, if you go to the next slide, please. It's very busy. I'm not going to go through the detail, and I'm sorry, some of the colors got altered when I used the template. But what I kind of want to point out here is that if you've got the variables there, which are currently in black, there on the left-hand side, and then what we're asking people to do through this reflective kind of process of evaluation of their CLM program was really to try and say, across each of those different rows, where do we fit? And the thing is no one's going to be policing you. UNAIDS is not going to come hit you over the head or anything like that if you're off the matrix or you get it wrong. It is up to groups to have implementers to have honest conversations. But the idea is you want to be moving implementations over time into those green areas to the right? And so the idea is that hopefully this way people see improvement as a step-by-step process, and that if you can't get all the way immediately, then that's fine. And I'll give you a good example of that. We're seeing in a number of countries where we have good engagement of PLHIV groups in CLM. They're the ones leading it, organizing it, doing data analysis, but we're not seeing necessarily the same kind of involvement or leadership from key populations. Those opportunities have not been there. Partly, sometimes this is around to donor issues. There isn't enough money in the system. Sometimes it's because of rivalries, if you will, between PLHIV and KP groups. But what we're saying there is that, okay, what is your plan to engage, you know, to get key population groups in more in leadership roles within CLM? Is this an issue of capacity? Do we need to do more capacity building? Is this a question around money? Do we need to find more donors? Is this a question, are there other issues at play? So that's the type of conversation you can start to have using the matrix to kind of see, are we meeting minimum standards? If you can see yourself anywhere on this matrix in the yellow, brownish or green areas, then you are implementing CLM. But even if you're not fully on the matrix, we'd say you can be aiming for it, right? So aiming for a standard, recognizing the challenging context many of you face and the diversity of issues on the ground, but also really importantly, I think somebody mentioned donor when I dialed in just a second ago, some of the funding challenges. We have to be realistic about what can be done with sometimes relatively small pools of money, and we can't gauge every group. So the matrix, please, you can go through it in more detail. I've got a little guidance document which I will forward to the organizer so that can be distributed, which gives a little bit more detail. And I'm really happy to answer questions or have conversations about the matrix. It's great for us to get feedback as well in terms of how you're interpreting some of the things that we've written so that we can make adjustments as well. Go to the next slide. It's my last one. So moving forward, right? So I've just introduced the matrix. Some of you might be totally new. Some of you may have seen it a little bit before. So some key questions I think for you to think about is, are you using the matrix already? I know there was a mapping exercise that was done in the Asia region using the matrix. Can you incorporate your matrix into reporting and planning? And remember, as I said, it's a reflective process, right? So the perfect time to start using the matrix, if you aren't, is when you're reporting back on activities that have already been undertaken. Because in fact, it gives you an opportunity year by year to kind of monitor yourself and kind of give you the opportunity to assess where you are back to your donor. And I guess one of the key things, though, in terms of the nuts and bolts of doing going through the process with the matrix is how you facilitate that conversation. Because one of the key things we don't want to do is have communities saying, we really want to use this tool. They get all the partners around the table and then they're the ones facilitating the process and therefore not really being fully participants. In an ideal world, there'd always be like an external facilitator. That may obviously, because of the costs involved, not always be possible. But we want to make sure that if you're kind of leading the implementation, you're not necessarily only facilitating and therefore not able to contribute fully. And then the last question is that when you have gone through this process, wherever you might be, whether you're mostly in the red outside of the matrix, whether you're kind of just about on there, or if you're doing well, how long do you think it would take to get to the green areas? Is that even feasible given the context that you're working in? Because we know that, again, as I said, donor issues, political context may mean there are limitations. And I would also add an asterisk there, is that the other thing with the matrix is that because context can change, governments change, money changes, it's not always going to be a move to the right into the green, right? You may also see in time people go backwards. So anyway, that's the matrix in a nutshell. I think the next slide has my email if you want to get in touch. As I said, I will share the document with everybody. And hopefully, despite the announcements every now and then, you're able to understand.
Oh, thanks so much, Dom. Yeah, we can hear you loud and clear, and looking forward to getting the documents, and we'll be able to share that with everyone here as well. Thank you for joining us from the airport. I hope the rest of your journey goes well.
Thank you.
We are running a bit out of time, but I just want to kind of give this time to basically say thank you to everyone for joining a 3-hour webinar. I mean, that's really, really good in this day and age where, we've been, on the Zoom calls, team calls for a long time. And I know that it really does up a lot of your energy. So thank you for staying engaged and being with us this afternoon. And don't forget, tomorrow we'll have also a discussion on the cross-learning and sharing as well that ICWAP, CETA will be leading on. So please do join us on those as well. I want to say a special thank you for the leadership from the regional networks, in particular APN Plus, Harry, APNSW, KT, APTN, Joe Wong, ICWAP, Sita, Naput, Francis, and Youth Lead Ika for such a leadership in terms of putting all of us together, our community networks together to take part in this amazing series of webinars. Thank you so much to Shane for representing PACU, and also to the US CDC and UNAIDS RST Asia Pacific for the support in terms of resources for ensuring that we can do this series of webinars led by the key population networks as well. We're also thankful for the speakers, particularly from RAIN at the CRG team or from the Global Fund, Yelana from ITPC as well, all the way from Malawi, and of course our speakers from the countries, the Cambodian People Living with HIV Network, Sopal, and also from Yashwinder Singh, who is representing the Pahal Foundation in India. And then, of course, I want to say a special thank you to the APCOM team, who's been really behind the scene, particularly Selvin Anthony, who's been coordinating, and then also to Vanessa, Bobo, and JJ, who's been also doing all the background work that you might not actually get to see out here. But there's such an integral part for making sure that this webinar happens. And thank you so much, everyone, for all your support. And we look forward to seeing you again tomorrow. สวัสดีครับ